gonna probably be upside down and backwards.
Yeah, but I can flip my phone.
Oh, okay. All right, how many think you did okay on that test?
Other than the superior, it looks
right,
it looks like S, Professor. I'm not even kidding. Just,
So
I'm
even
just-
for the first test.
It was even from the first test. You thought that no one thought that was a hard test.
No.
It was very.
All right, so we're gonna start respiration, and next week I will give you a sheet that has everything listed on it that you have to know. Pretty much what we're gonna do for the rest of the semester is just go over models, and I'll point things out to you on the models, and then you'll have a list of things that you have to know for the final and for the third exam. So the third exam was not gonna probably be for a number of weeks. Okay, maybe we'll do it like the week before we go on Easter break. We'll see how we're doing with it. It'll be on the venous system and on respiration. So we'll start with these models today. Don't worry about this side. We're not going to worry, do that side. Basically, it's sort of like a cross-section of the head. Okay, obviously, you probably could pick at some parts. Here's your orbit. The brain up here. Here's your tongue. So it's your oral cavity. And your teeth. But we're not going to, and these are your conch. But we're not going to worry about that side. We'll worry about this side. So what you're looking at is really the upper respiratory system, the upper airways here. So when air comes in, it's going to come in through your nostrils and the nose, okay, which is called the external nares. And it's going to come into what's called the vestibule over here. So the air comes into the external nares, into the vestibule of the nose, and you're looking at the lateral side of the nasal cavity here. Okay, if you were looking at the medial side, you'd be looking at the septum, and this would be covered up with the perpendicular plate and the vomer. But what you're looking at is the actual, like I said, the lateral side. So you're looking at the nasal conch. So you have the superior and the middle nasal conch, which is part of what bone?
Ethmoid.
Good, ethmoid bone. So your 131 stuff's going to come back. Because here's your cristagalli. This up here is your frontal sinus. And this is the sphenoid sinus. Here's your sella turcica with the pituitary gland again. So you're basically in the region of the ethmoid, superior and middle conch. This one here is the inferior nasal conch, separate bone of the facial region. So basically they're bony structures. So the question is, how is the air going to get back from the front of the nose, the anterior portion and the vestibule, back into the posterior portion of the nasal septum, or of the nasal cavity, I should say. Underneath each conch, you're going to have a meatus or a canal. So underneath the superior conch, you have the superior meatus, middle, the middle meatus, and inferior, the inferior meatus. So the air actually comes through these meatuses, or canals, back into the internal nares, which is where they all come together. So the conch, remember, is covered with mucous membranes. So it warms the air, it humidifies it, it filters it. Okay, it's got that ciliated epithelium that you can sort of sweep out the dust and the dirt. Okay, so basically, the canals, the air runs through them, okay, over the conch, and then they come back into the internal nares. Now, just posterior to the internal nares here, you're going to have the pharynx, or the throat, and it runs all the way down here. Divided up in three portions. One is behind the nose, is the nasopharynx. Behind the mouth is the oropharynx. And behind the larynx is the laryngopharynx, or the hypopharynx. So, in here is your nasopharynx. It's right behind the nose. And there are two structures that I want you guys to know here. One is the opening here, which is for, anyone remember, the ear? In the ear, in the middle ear, you had the ear ossicles and the internal part of the tympanic membrane, but you also had the eustachian or the auditory tube, and this is the opening for it. Because what happens is that the middle ear connects with the nasopharynx. When you go up in an airplane and your ears pop, you need to equilibrate the pressure. So you usually try to swallow or chew gum or eat something so that that tube opens up. basically what you're doing is equilibrating the pressure between the middle ear and the nasopharynx. Okay, that's how you get middle ear infections. Because even though that tube is flat and should be closed, every time you yawn, you snore, you cough, it opens up, okay, and bacteria, viruses can get in and cause middle ear infections. So that's the opening for the auditory eustachian tube. This structure here is the adenoids or the pharyngeal tonsil. Okay, and there are three tonsils, three sets of tonsils. Okay, this is the pharyngeal tonsil. Okay, actually, they're probably really, the pharyngeal tonsil isn't paired. It's probably just one big piece in the nasopharynx. But that's the pharyngeal. Then you come down into the area of the oral cavity. Here's your tongue. Here's the mandible. Okay. Here's the lips, the teeth. Here's the hard palate. So you have the maxilla here, which was, if you remember from 131, the palatine process of the maxilla. And this little piece back here is the horizontal plates of the palatine bone. The whole thing for us is the hard palate. I'm not going to ask you horizontal plates, palatine process, or bones. So this is your hard palate. Okay, this is the soft palate. And this little guy hanging off here is the uvula. Okay. When you open up your mouth and look in the mirror, the thing that's hanging down is the uvula. It's really the end of the soft palate. So you have the bony hard palate, and then the soft palate, and then the uvula. Okay. And then behind, this is the oral cavity in here, the opening. Back here is the oropharynx. Now, there are two tonsils in the oropharynx. One is right under the tongue here is the lingual like in speech, the tongue, okay, is the lingual tonsil. And then deep in here, which you may have a problem seeing until you get the model in front of you, is the palatine tonsil. Okay, basically to go along with the palate, palatine bone, that's the palatine tonsil. Okay, and so in the oropharynx, palatine tonsil, lingual tonsil. Now you're going to come down, and here's your larynx in here. This little structure here is the epiglottis. The epiglottis is going to cover over the airways when you're swallowing. Here's the esophagus. So you're looking, the pharynx is really a common pathway for both air and food. Okay? You don't want food in the nasopharynx. We'll talk more about that when we do digestion. When you look at the swallowing reflex, basically, the uvula and the soft palate should actually move up, covering over the nasopharynx so that food doesn't go up there. Okay, but if you're talking or laughing while you're eating, okay, you've all experienced, fluids going up into your nose or food or something like that. Okay, and that's because while you're coughing and talking and things like that, the reflex gets messed up. But the normal reflex is that basically this should come up and cover the nasopharynx. So the food should then just go down through the oropharynx and then the laryngopharynx into the esophagus back here. Here's your trachea. Here's the esophagus. So when you're swallowing, this little epiglottis here should cover over the airways, and the food should just go down into the esophagus. This little bone in here is what? The hyoid bone. Okay. The hyoid bone is basically attached to muscles. It's the only bone in the body that doesn't attach to another bone. Okay. It attaches to the muscles in the mouth, okay, and sort of muscles of the larynx, okay, and structures of the larynx. You can see here, we'll see it on that model in a minute. So that's the hyoid bone. Okay, that's the epiglottis. And then behind here, in the pharynx, is the laryngopharynx or the hypopharynx. We're going to look at these on the model in a minute, but this is the thyroid cartilage of the larynx. This is the cricoid cartilage. Okay, and in here you have your vocal cords. And the opening, the space in the vocal cords, is called the glottis. And then the line is basically your true cords, and I'll show it to you on the other model. Down here you already have your trachea, and you have some of the thyroid gland and so on. So that's sort of the upper airways. This by now you all know is what? The diaphragm. This is the larynx model. Okay, obviously much bigger than it is in normal life. Okay, what bone is this? Hyoid bone. The hyoid is connected to the thyroid cartilage. This is the thyroid cartilage of the larynx. Okay, it's also known as the Adam's apple. Okay, and here's the laryngeal prominence. Okay, someone asked me in Tuesday's lab, why is the Adam's apple bigger in males than females? I really didn't have an answer for it. I sent him out to go find an answer. Because it's really, it really shouldn't be any more superficial or deep in either sex. But we'll see if he comes back with an answer. So connecting the hyoid to the thyroid cartilage, this is the thyrohyoid membrane.
She's looking for.
This is still the same as mine, I don't know.
I'm not going to say anything. Okay, the hyoid and thyroid cartilage, and this again is the thyrohyoid membrane. Okay, the other cartilage that you can see on here is the cricoid cartilage. Okay, and you can see it in the posteriorly, much more prominent, the cricoid or cricoid.
How do you spell that?
Cricoid or cricoid.
Okay.
And then this is all thyroid cartilage here. The other three, you can't see on here. Okay, you have to bring in the smaller larynxes. I'll do that next week. You have the posterior cartilages are basically cuneiform, corniculate, and arytenoids. Okay, you can see it on some of the smaller models. For some reason they didn't, or some of the newer models like this. Okay, but on this one you can't see it. So you're seeing the cricoid and thyroid. So the ligaments now, you're going to name between the two structures. So the thyroid and the cricoid is the thyrocricoid ligament, and this is the thyrocricoid muscle. And between the cricoid and the trachea, you have the cricotracheal ligament. So cricotracheal, thyrocricoid or cricothyroid, and the thyrohyoid membrane. Okay, and then these are your rings of cartilage, the C rings of cartilage in the trachea. Okay, it's an incomplete structure. Okay, we'll see what happens in the posterior aspect in a minute. And these are known as annulus ligaments between the cartilage rings. This is obviously the thyroid gland. If you look at the posterior aspect, the muscle here covers over the posterior aspect of the trachea. It's called the trachealis muscle. Trachealis. Epiglottis. The orange structure there, down in there, is your true vocal cords.
True vocal
The true vocal cords.
The flap that you're holding up is the epiglottis?
The flap is the epiglottis. The orange is the true vocal cords. The line in between is the glottis. Okay, and on this particular model, the false cords actually have been taken away. Okay, we actually velcroed the false cords onto there, but they're no longer there. So really the true cords are really the top of it that actually moves. Okay, and then they're attached to the false cords.
You said the space between the true vocal cords is called the glottis?
Glottis, the opening is the glottis. So basically here we have the lungs, which is really the main organ of respiration. The rest of it is all airways. The nose, the mouth, the pharynx, the trachea, the larynx, it's basically all airways. Okay, it's not until you get into the lungs that actually something's going to happen. And when we start respiration, we'll see there's a lot of dead space there. Normally you only take in about 500 cc's of air when you're quietly breathing. So all that air may not actually get into the alveoli of the lungs. There's a lot of anatomical and physiological dead space. But let's see if you can name these vessels. What vessel is this?
Oh, that's the pulmonary artery.
Pulmonary artery.
Longer down here, can't be
Pulmonary artery.
subclavian. Internal jugular. Brachiocephalic.
Oh,
Superior vena
now I
cava.
see the angle, okay.
Clavian, internal jugular, brachiocephalic, superior vena cava, subclavian, internal jugular, brachiocephalic, superior vena cava. The red, basically your brachiocephalic trunk, right common carotid, right subclavian, left common carotid, left subclavian. So, the lungs. The right lung is bigger than the left. Okay, the right has 3 lobes, the superior, the middle, and the inferior. On the right side, you have the horizontal fissure, and you have the oblique or diagonal fissure. So the horizontal separates the superior from the middle, and the inferior, the middle from the inferior, the oblique fissure. On the left side, because the heart sits slightly to the left, you have 2 lobes, the superior, the oblique fissure, and the inferior lobe, and the cardiac notch here.
Could you say that again? I'm sorry.
On the right side, you have the superior lobe, the horizontal fissure, the middle lobe, the oblique fissure, and the inferior lobe. On the left side, you have the superior lobe, the oblique fissure, and the inferior lobe, and the cardiac notch in here. All of this down here is the diaphragm. So, the red vessel there is your thoracic aorta. The pink structure is the esophagus. If you look down there in the esophagus, you can see the lower esophageal sphincter, which would enter the stomach. You're not seeing the stomach there, but that's what it is. When you look here, this is the hilus of the lungs. Okay, the hilus is where the bronchi come in, and the pulmonary artery, and the pulmonary veins go out, pulmonary artery goes in. So, this is your trachea up here, the blue, and the esophagus is right behind it. Okay, and here's your trachea here. Now the trachea splits, it bifurcates, and then there's an internal ridge in there that you can't see, but it's like a little ridge on the inside. It's called the carina. And then these are your primary bronchi. So your trachea branches into your 2 primary bronchi, one to the right and one to the left. And then on the right, you have secondary bronchi, and then tertiary bronchi out here. How many bronchi, secondary bronchi, do you see on the right side?
3.
Correct. One to the superior, one to the middle, one to the inferior lobe. Okay, 2 on the left, one to the superior, one to the inferior lobe. Basically, then you have your tertiary bronchi out here. Again, pulmonary veins and blue pulmonary arteries. And then you get your microscopic structures further out here, your bronchioles and alveoli. Now, sometimes you hear them talk about the respiratory tree and things like that. If you turn it upside down, the trachea is the trunk. Okay, and then you have your branches. Your branches is the tree, your primary bronchi, your secondaries, your tertiaries, and then the bronchioles and the alveoli are like the leaves, way out here. Okay, we'll take a look at this in lecture when we get to it, and you'll see how much surface area there is when you get to the capillaries. Well, we haven't done the capillaries in class yet for cardiovascular, but when you get to the alveoli, also a lot of surface area. So, that is the respiration. There's a few more models, but we'll do that next time.